So as you know, there are a lot of paper about screw accuracy. We have a lot of, but cage location accuracy is a very few paper. Today I talk about this issue. Let's begin with this case. This is deformity. I also do a lot of deformity. In the most important apical area, I didn't put any pedicule screw. Do you know the reason why? Because if you take CAT scan, very narrow pedicule, you shouldn't take a risk of this kind of. So Abenere is my best friend. He said, you don't need any CAT scan, but it's better for you to take CAT scan before risky surgery. Several years ago, we published this kind of paper based on the literature. So as you know, C-arm technique, compared with C-arm technique, preoperative CT-based navigation is a little better. But nowadays, you can use intraoperative CT-based navigation. In our case, we use O-arm. I'm not saying you should have O-arm because it's very expensive. Sometimes it's not worth it. But if you have C-arm, at least you should use C-arm. So background. So MI strip has been a common surgical procedure for lumbar interbody fusion. However, precise pedicule screw placement and cage insertion remains a critical concern for us. This study aimed to compare the outcome of MIS strip performed with C-arm technique and C-arm-free O-arm navigation technique. Study design is a retrospective comparative study. Inclusion criteria was 1 or 2 level TIF due to lumbar degenerative disease, not metastasis or not infection. 43 patients are included in this study. So we did clinical evaluation, including ODI, BAS, and complications such as dural tear, neurological deterioration, epidural hematoma, and SSI. Let me explain our technique. First, we put a cage without C-arm because we are so much afraid of radiation exposure. Screw, as you know, it's very easy if you have a navigation. Radiological evaluation, we evaluate cage position. We separate the end plate, it's 9 portion, and also we check the cage rotation. We always use banana cage. Rectangular cage is not a good idea to create lumbar lordosis. Result. So navigation group 30, C-arm group is 13 because it's a small number, but age and fusion level are very similar between two groups. Surgical outcome, if you look at surgical time and blood loss, if you use C-arm or O-arm, very similar, not significant difference if you are a very good surgeon. However, cage position, if you look at the result, so navigation group, it's located in the center. C-arm group are a little bit anterior, but I'm not sure which one is better, center or a little anterior is better. If you would like to do indirect decompression as well, center is better. If you would like to create much more lordosis, anterior is better. Cage rotation is in navigation group 78 degree and C-arm group is 80, no difference. However, if you look at surgical complication, screw position of navigation group was better than C-arm group. Screw loosening, malunion, dural tear, SSI, all these complications are similar. ODI, very similar. Discussion. The incidence of cage migration varies from 0.8 to 23% in the literature. There was no significant difference in operating time and blood loss, even though you use O-arm, if you use C-arm. Same, usually same. But importantly, the use of O-arm navigation substantially reduce the surgeon's exposure to the radiation risk. This is very important for me. You should think about radiation exposure very seriously. Left one is a paper from Europe. If you take a lot of picture for X-ray for AIS patient has 5 times cancer risk because of radiation. For your orthopedic surgeon, so we have 10 times radiation risk compared with other doctors. As you know, several doctors have passed away because of thyroid cancer. New concept is CM-free technique. This is very similar to navigation technique, but I never use CM, never use. Just take, I necessary, I take radiation, X-ray. So it's not completely different from freehand technique. Freehand technique is very dangerous. A little similar to sugar-free diet because both are very good for your health. In conclusion, this study highlights O-arm navigation significantly improves screw placement accuracy and with acceptable cage placement. The reduction in radiation exposure with O-arm technique is very beneficial for spine team. These results encourage that the use of O-arm navigation in spinal fusion surgery are very useful for your clinical technique. Thank you for your attention.